Well, good afternoon and welcome to the Harvard Chan studio. I'm Rifat Atun, I'm Professor of Global Health Systems at Harvard University. It's a real pleasure to bring together an outstanding panel of healthcare leaders and academic experts for today's discussion on leading academic medical centers in turbulent times. Today's conversation is all about crisis leadership and how we behave as leaders, how we make decisions under pressure, and how we guide our organizations with clarity and resilience. This is the third installment of the Pressure Point series, a joint series organized by the studio and Harvard Chan Executive Continuing and Education at the school. And I'm very pleased to introduce our distinguished panel. Ted Witherell, who is a lecturer in health management at Harvard Chan School, Tiffany Moore-Simas, who is chair and Department of Obstetrics and Gynecology at UMass Memorial Health, and professor at UMass Chan Medical School, relation to Harvard Chan, of course. And she's an alum of the MPH 06, as well as the Masters in Healthcare Management in 2025. And of course, Tor Sund, who's Chief Division of Cardiac Surgery and Director of Corrigan-Minnehaha Heart Center at the Mass General Hospital. It's a real pleasure and privilege to moderate such a distinguished panel. We'll explore in a conversation some of the most pressing challenges that you and your organization face in these turbulent times and look for some solutions. So let me start with a warm-up question. Not an easy one, but a warm-up question. So what feels most challenging about the current moment for academic medical centers? And how is this cumulative strain manifesting in your people and in your organizations? So I'll start with Tor, then go to Tiffany, then to Ted.
Well, thanks very much for the question. I don't think it's a mystery to anybody that a big challenge for academic medical centers in particular is this disconnect or conflict, tension that exists between the economic realities that we face and the academic mission, which is not revenue generating. Teaching is not revenue generating. Research in the long run can be, but in the short run certainly is not. And so there's no doubt that there are enormous pressures placed on our academic institutions to conform to the economic realities and to adapt to the economic realities. And that creates, it's oftentimes expressed as this tension between corporate culture and service culture. We are service providers as caregivers. That doesn't necessarily connect with the corporate mentality, but we've got to. Both sides need to understand the other. We somehow have to communicate with each other and recognize what the realities are on both sides of the street. So the service providers have got to understand and appreciate what the corporate realities are and how we're going to function with those tensions and pressures. At the same time, one would hope, and this is my greatest concern, is that I worry about the balance here, that the individuals who come from the more corporate side of things and understand those economic realities need to appreciate and understand that the value is created by the service providers. So this tension that exists between the two sides, the leadership, I think, has to bridge those gaps and communicate to both sides where the values are and what the economic realities are. That's the strain that I see, and the manifestation of the problem is that as service providers tend to feel undervalued, and that's, I think, why we see so many clinicians exiting healthcare and exiting our big organizations, because they don't feel valued. That's the way I would, maybe too long of an answer.
But very important. In addition to the sort of turbulent environment, there are these major tensions, but also losing very important sort of assets of organizations at a time when the organization needs them most. So Tiffany, how are these manifesting in yours?
I mean, I would agree with everything that you had to say. I mean, I truly feel privileged to be a professional, both, person and a professional in an academic healthcare environment. And, it's not a pressure point, it's many pressure points, right, happening simultaneously, right? We have been committed since the dawn of academic medicine to at least minimally the missions of clinical care, education, and research. And one might argue we've added significantly to those as relates to community, to equity, to service in a lot of ways, right? And we are trying to do all of that amidst, yes, the financial pressures, and in light of that, also workforce shortages, right, regulatory burden, and, what seems at times shifting values. Even if our own internal core values haven't shifted, our own institutional values haven't shifted, we are working, sort of in a social environment that is sort of constantly asking us to think about things differently. And so how do we hold strong to those values while still addressing the needs?
Yes, Ted, reflections.
Also, sort of violent agreement now across the board. I love the way you phrased the question. You talked about cumulative strain.
Yes.
And to me, the answer to the question of what's most challenging is that. It is the cumulative strain, all these things you've talked about, and it's that reaction. I do a lot of executive coaching of various leaders across healthcare, but in particular, a lot of physician leaders. And there's a group of us who do this work, try to help the people who are helpers. And we got together last week, and the prevailing theme that came out of our discussion was sadness. And people leaving the profession, as you just said, but this sadness is kind of hanging over. This is kind of an existential threat. And the way I look at this, the turbulent times, I'm going to borrow heavily as we have this conversation from a really good article written by Michaela Kerosy, who's on our faculty here, with Amy Edmondson, who's on the faculty in the business school at Harvard. And what they talk about is the distinction between an acute crisis and a sustained crisis. And I know we're going to talk a lot about that through this theme, but to me that's so powerful. That's really a lot of what we're really talking about here. I had a colleague many years ago, a leader at Brigham and Women's Hospital many years ago, who said, we are really good in a crisis. Nobody's better than us in a crisis. It's the times between the crises that we're not so good at. So how do we think about now, without this acute crisis? We think about the earliest days of COVID when there was a target and a thing, right? This acuteness. And now where we find ourselves with this sort of existential set of threats, as you talk about, just kind of looming out there. That transition right now, I think, is creating a lot of strain.
Yeah, so that's a perfect segue actually to the next question I had in mind. So this is not just one crisis. So these are series of crises, interlinked crises, leading to sort of ongoing turbulence and pressure. And it seems that there's no clear insight to these. And of course, and you also mentioned sort of cumulative exposures and cumulative pressure. So one has to respond to every action, to a crisis, an acute crisis, but one also has to respond to multiple exposures, and that's resilience. So responsiveness and resilience, which together ensure sustainability. So in this times of crisis, how do you as leaders ensure that with the rapidly changing context and the sustained turbulence, how do you ensure resilience and stability? Of course, you're facing financial challenges and workforce challenges, and we'll explore these in our February 24th event on pressure points, balancing clinical and financial priorities. But I want to focus on the leadership response to these acute crises that you're facing, as well as cumulative crises. So I'll start with let me see. I'll start with Tiffany, then go to Tor, then to Ted.
Yeah. And I think you're asking about how do we build resilience and what does resilience look like? We often think about resilience at the level of an individual, right? And thinking about individual grit and endurance, that is not the conversation we should be having, right? We really should be having conversations about the resilience of an organization, right? And a system's ability to absorb shock, to adapt without losing its values, to remain focused on delivering its core mission, and as we already talked about, in all the various mission areas. So, I am fortunate to have, we were just discussing, I've been at the same organization for a long time, and I feel truly fortunate to have sort of grown up there and developed in that leadership environment, because you really need a resilient organization. And part of that is it's at the front line, right? It's at the very core, the very first point of contact for the people who are doing the work, right? So at UMass Memorial, regardless of your job description, regardless of your training, regardless of your experience, you were hired in as a caregiver, you were hired in as a problem solver, and you were hired in as an innovator, right? And so in order to build resilient organizations, we need to make sure we're getting our ideas, right, and our guidance from the front lines, and that we have standardized and systematized ways to do that. You know, we just celebrated 200,000 ideas from frontline caregivers, right? And so it's so tempting as a leader to say, I need to figure this out, right? I need to hunker in, I need to look at the data and the dashboards, but we have to go right down to where the problems are, because that's where the solutions are. And part of resilience is trusting, right, our frontline teams and empowering them to help make the change we need.
Yes, and in developing resilience, how do you ensure in these turbulent times, how do you create pockets of stability? So clarity with routines, with clarity of purpose, and also some predictability. How does that happen?
Yeah, thank you for asking that. I mean, right, we need predictability where outcomes are not predictable, right? And so that can happen in the structures we set up, in our communication cadence, in how we transparently make decisions, right? And how we get there. And as much talking about what needs to change, what's forcing a change, what we want to change, what needs to change, is also talking about what we're not changing. We aren't changing our values. We aren't changing our missions. And so we are going to work within those boundaries as we look to establish the change.
Yeah, and I guess that's part of the trust building.
That's part of the trust building.
Yeah, Tor.
Yeah, I agree with all of that, and I think that you mentioned this, but I would want to emphasize it that it's all about the team. To me, the resilience or anti-fragility comes from the team. It's the how does the team interact? How do you make it a learning environment so that it's anti-fragile, if you will? The predictability is that I can rely on my team. I think that's the most important thing from the standpoint, at least, of my group. Our group is understanding what the rules of engagement are, understanding that you can rely on each other, understanding that none of us can do it all alone, understanding that all of us is smarter than any one of us, all of those concepts that relate to teamwork. And that's where the strength is, that's where the power is. It's got to be anchored in the values that you talked about. We have to agree that we have a shared set of values that bring us together. But it's really all about the team, I think.
And do you rely on the team to help develop these pockets of stability? Is it driven by the leader, or is it driven by the team, or is it both? Is it an interactive process?
I think that you frame the discussions, but you rely on that team. The frontline caregivers are the people who can come up with the solutions to the problems. Top down in something as complex as what we do, I don't think top down works. It just is going to upset the apple cart. It's the leader's job, in my view, to say, okay, this is the problem that needs to be solved. Frame it, the solution, whatever the solution is, has to fit within these constraints. But you're the ones who understand how the work is done. You can figure it out.
Ted.
I'm going to double down on some of what you both said. I'll start with where Tor was. That idea of sort of widening the aperture to involve other folks. In addition to all the benefits you just talked about, I think there's real value in this level of inclusion that you're talking about, right? So the idea of when we engage our folks, not only is it many hands make light the load, right? No leader can carry that, but also what we're doing is we're sort of attacking some of the psychic threats that people feel by not being connected and involved in the decision making, not being empowered. So there's a double benefit to that, I think, there. To me, that's one of the things. As I think about the responses, I kind of went to what is it that leaders can do, should do, need to do. So I kind of went to that place, the leader being the enabler of all this. And that's one of the things. I think the other, to double down on where you started, Tiffany, this idea of it's not an individual response, it's a collective response. It's an organizational responsibility here. I think oftentimes, well-intentioned, we put together programs around wellness, et cetera, and those are absolutely critical, really important. We absolutely need these. They're necessary, but they're not sufficient. And so I think that oftentimes happens is they then have to do all the lifting for everything else. And what happens is almost there's some cognitive dissonance that comes in, because I find myself now having to deal with my own wellness. There's a problem with me. And in an insane society, the sane appear insane, right? So this idea of that, wait, it's not just me, there must be something else here. So to me, the larger solution is leaders going after some of these root causes. And that gets at inclusiveness, because the front line, I love that 200,000 ideas.
200,000, yeah.
That's where we find that stuff. Setting priorities, making clear. There's a temptation that leaders, especially in healthcare, we put that mantle on and we say, we are going to provide certainty to our folks, which is a fool's errand. We need to get busy on providing clarity. And that involves setting priorities and what do we do and not do, which AMCs are terrible at, right? So that's another space. And then the last thing I would say is I think leaders can put into place kind of a makeover of the culture. We have a heroic culture. I have one faculty member in one of the programs that I run who is an operational expert, and he talks about how he would love to see in the newsletter this week all the systems and processes worked as they're supposed to, and that's it. We tend to reward from the earliest days of training heroic efforts on behalf of our patients, and that's wonderful and good, but I think it's contributing to the challenges we find ourselves in.
So each of you mentioned sort of the sustained pressure in this turbulent environment and the pressure on individuals but also teams. And I heard the word undervalued, but also increasingly individuals and teams sort of burning out. So how is this burnout and low morale affecting behavior changes in the frontline health workforce among clinicians, teams, or leaders? And which of these behavior changes are worrying you most? So let me go back to Tor, then Tiffany, then Ted.
Checking out, that's the problem. People check out. And become increasingly isolated. I'm focused on the team. I'm obsessed with the team, and they become feel less part of the community. Pressure on an individual tends to isolate them, I think, and they feel less a part of the community. And again, the strength is in the community. So I worry about people when they're communicating less, participating less. In whatever the activities are, whether it's a division meeting, a social event, whatever. When you see less of them, that's a problem, and you need to. Would hope that one can identify that and encourage people to re-engage and re-participate, because you get your strength from the others. Everybody's got highs and lows, and you need to have somebody in your life or people in your life that when you're low, they're high, and you can equilibrate one another.
And as leaders, how do you sort of model the kind of behaviors that need to happen to counteract some of the points that you've identified? People checking out, isolation, less participation. Yeah. Well, what would you do to ensure sort of the well-being?
Well, I'm very visible when I ask for help. I'm a surgeon. I'm a cardiac surgeon. I ask for help in the operating room. Call so and so. Very, very, very conspicuously and unashamedly. So I think role modeling that sort of thing, that you're part of the team and you rely on the team, those kinds of things I think are important.
Excellent. Tiffany.
Yeah. So not surprisingly, I agree with everything you just mentioned. I mean, what's most concerning, right, at the clinician level, it is that it's the more sort of subterfuge behaviors. It's not as obvious in a way that you can address it, right? It is that sort of like quiet adaptive shifting, right? For the clinician, it's less volunteering to take a student in your clinic. It's less volunteering to engage in a quality activity because it's one more thing. It's not one more thing. It may be the thing, right? That is too much for some people. And additionally, we see increased boundary setting, and I have to be careful when I say that because I think it's important for people to set boundaries, right? But also for what really was sort of a life's calling historically for many people is becoming very transactional, out of survival, right, in a system that isn't nurturing and tending to what individuals need. And then it impacts people at the team level, right? We talked about how important teams are. None of us are individual contributors, right? We really function within a team, but we need teams to work together, right, to trust each other, to raise concerns, to tolerate less, to be able to tolerate some ambiguity and to trust in the system. And we're seeing that. And again, more transactional. teams can't be avatars to each other. They really need to get to know each other. Do we bake in the time to allow for that personal interaction so that you are working amidst trusted friends and colleagues and not just a team member, right? And then from a leadership level, I think we see it in two ways. One, we see the leaders that are like, okay, everybody's burnt out, I'm gonna like take it on. I'm afraid to ask. I'm either afraid to ask, or I know when I ask I'm not gonna get those volunteers, so I just take on more. And then that's not sustainable, right? We spent the beginning part of this talking about how we need everybody to be all in. And so we can't encourage the behaviors that promote the hero, right? We need really, resilient teams. And then the flip side of that is the person who just kind of becomes invisible, sort of leads from the corner office as opposed to going down and engaging, right? And so, I think those are the risks. How do we combat those risks as leaders? One is, all right, call it out, right? Have real conversations around what the challenges are. Not dramatically, right? But call it out. Say what we're dealing with. Ask for help, right? I need help coming up with ideas to address this issue, right? And take time, right? Take time for yourself. Model. Taking time off is not a reward for having worked hard. It is a necessary part of taking care of one's own wellness, and model that in doing it. Put your out of office message on. I'm away with family. I'm not going to be checking in on things. I trust my team to take care of it when I'm out. And we often say, you can't improve what you don't measure. So, one of the things we did is we actually track people's time off in a positive way. We noticed you only took 50% of your, paid time off. You're halfway through the year. That's great. I assume you're going to take the rest. Or we noticed you only took 10% of your time off. We're halfway through the year. I hope you have plans. We want you to do that, right? So make present and obvious that you are prioritizing that kind of wellness.
Yes. Ted?
Again, agree on so much of what y'all just said. I put a finer point on a couple of them. I think going back to what I said before, my colleagues noticing this level of sadness. And what I'm seeing is there was a question that folks would ask before of will we be okay? Was kind of the question folks were asking before. And now I'm hearing kind of shift to why bother? And that's a little bit of what was behind the exodus that you're talking about. So I give two examples from coaching folks that I work with just yesterday, coaching conversations. One is at a high level executive in the healthcare system, and this person, the entire conversation was around, should I stay or should I go? And it kind of came back from that one thing that you just said, that one thing that made that person feel unappreciated and pulled them away from their why. Why does I'm doing this? Contrast that to another example, another leader I've been working with, who, when we faced some of the challenges that we're facing in the research community, this person actually ended up creating a solution that spun into a company, an organization, right, and that's kind of helping to fill in that gap while still continuing to lead all kinds of different new efforts in an academic medical center at the same time. And there's something about the two of those that to me provide such a contrast, and it's not as much behavior as it is attitudinal. The one other example I would give that I think kind of gets at the attitudinal, and this goes back to the earliest days when the COVID pandemic first came up, and there's one particular leader who's kind of a lesser leader in a very large system, right? And this person demonstrated kind of a shift from stoic competence. It's what you kind of talk about, right? That's the motto we have, the stoic competence, to authentic vulnerability. He basically, in his now weekly communications, right, which hadn't been a thing before, said, I spilled coffee on myself and I had this really awful overreaction, and it humanized him in the same way that you're just talking about. So to me, that authenticity and that sort of vulnerability is what we need to see more of. So.
Yeah, if I can jump in.
Yes, of course.
That transparency and vulnerability and authenticity, I think we don't want our leaders to pretend like there's nothing going on. We want them to be honest and open, and yes, this is a problem, let's solve it together, and let's get in it together. I think that's really important.
For the people and for the leader as well.
All parties, because it's the truth. We all have to solve it together.
Yes, so we're all in it together. Now, I love the stoic competence versus authentic vulnerability. Yes, and one talks about authentic leadership,
Mm-hmm.
but also behaviors that actually signal and demonstrate what leaders should do. And coming back to leadership, of course, in these turbulent times, leaders have an important opportunity to lead. It's not just the role, it's a series of actions, and you've articulated what the leader should do in order to respond to crisis, but also ensure resilience with pockets of stability, ensuring that the teams are in place and are able to respond and recognize all the symptoms and patterns that you talked about, some of the behavior changes that are happening. But one of the other important roles for leaders is to develop next generation of leaders. And in crises, often leadership development is deprioritized. It's seen as a luxury. Why should we go on a course? But this must be one of the must be one of the most important investments organizations can make. And of course, I'll use a plug. At the Harvard Chan, we have lots of leadership programs designed specifically for managing different types of realities in healthcare organizations today in the US and beyond, supporting clinicians, other health professionals and leaders as they take on greater responsibilities, very complex organizations in highly pressurized environments. And we'll share these courses with you on the YouTube chat, but also in a follow-up email for those who are attending in person, but also those who are attending online. And in that context, I'd like to turn to my panelists to understand how you as leaders and how your organizations that you lead develop the next generation of leaders. And let me start with Ted. And Ted leads several of our leadership courses at Harvard and at the Executive and Continuing Education. What leadership capabilities matter most now, but will matter over the next decade as we're developing next generation of leaders? And how could we build these competences with a purpose?
I love the way you frame that. That's it's such a powerful way to think about it. First of all, you get no argument from me that it's important to invest in this. I just, in my career, 30 years working inside an organization, being the one who did the leadership development and seeing that be the first thing to go when we needed it most. And also what I'm finding in my role here at Chan is that so much of the leadership development does not take place inside organizations. So they find these external places to come. So I'd answer the question about what the most important competencies are in two ways. The first way is that it depends, right? And so what I mean by that is that it depends on what you as an individual need, what is holding you back as an individual. And a lot of the work that I'll do in coaching is to help folks kind of uncover that. What is the thing that's holding you back most? And we all have to kind of uncover that ourselves. In my experience, most of the time that thing that is holding us back is not something that's missing, but a strength that we've got that we're overplaying. So this idea of developing other and broader skills becomes important. So to me, that's one sort of the best answer, right? If I look at the list of competencies and go to the model, the National Center for Healthcare Leadership has a really wonderful model that says these are all the things. At any given time, they might sort of switch. But I would say, if you nailed me down to talk about three right now, I would say they are financial acumen, learning, and boundary spanning. Financial acumen, one of the programs that I lead is for physicians, mostly chiefs, medical directors, and we ask them to apply. In the application process, we ask them, what's your weakness, right? And which is very hard for physicians to answer. And most of the time they say finance. And that's partly because it's not taught formally, so that they're learning, and they don't. I think it's more important is because they don't have the confidence in the knowledge that they've got. So in essence, it's not so much about gaining deep financial expertise, although understanding the business of healthcare is critical, but it's more about understanding well enough to have the conversations with the people who do. The learning one, to me, this has always been a critical when we think about future leaders. One of the most important determinants of someone who's going to be a good investment in a high potential for the future is their ability to learn. And never has that been more important than now, right? This idea of the proliferation and speed of information, it's not going to go away. So knowing is no longer the thing, right? And that's been like a huge shift. We can't know anymore. So we need to have people in place who are able to learn, able to find information. And we're not talking much about ChatGPT, but that's really kind of at the core of that. And in fact, there's some recent research that talks about to be able to be effective in utilizing and leveraging ChatGPT, we need to have a level of ability to learn, a level of metacognition, the ability to think about how we think. So that's around the learning piece. And a big piece of learning, I believe, is this idea of being able to have emotional intelligence and being able to be sort of self-reflective. I often ask my coaching clients, how do you process inspiration? And rarely does anybody have an answer because we don't typically have practices around this. It's a luxury to take the time for that. But in situ, which is the way we're learning now, we have to. We act, reflect. It's a cycle. So we need to build in that time to reflect. And the last one I'll talk about is this boundary spanning, this idea of over the past 10 to 15 years in particular, the idea to work across boundaries, across my department, across my organization, across my system, outside of my system, in other industries. I was fortunate to be a part of the group that stood up the Boston Hope Field Hospital in the earliest days of COVID. And it was absolutely wonderful collaboration of this boundary spanning because it had the military was involved, we had medical personnel involved, we had nonprofits involved, and we had the government involved, kind of all across the board. That is more and more important. And in particular, this is my plug for public health, in academic medical centers, those of us who lead them need to be attending to the mission of public health, and boundary spanning is critical for that. So
Yeah.
I go on, I'll stop there.
No, absolutely. But these are really important points. Financial acumen. I remember very early on in my career, I made a decision to do an MBA because I didn't understand finance. So it was very helpful. And then I used to run courses for young doctors, and they all went bankrupt very quickly. We used to do teaching cases, and so they didn't understand this concept of cash flow. So within 18 months of taking over a new practice or a department, they'll be bankrupt. So I can relate to that. So learning and boundary spanning, of course, in the innovation literature, there's a lot of work around boundary spanning and importance of this in innovation. So Tiffany, what competencies do you see as being necessary today, but also in the near future, maybe in addition to those brought up by Ted?
Yeah, I mean, I think it's critical to recognize that the leadership capabilities that sort of got leaders here today are not necessarily the ones that they're going to need going forward. And when we talk about leadership development, we often think about the next generation of leaders, except our current leaders will continue to lead for some time, and so need to be humble enough to recognize that they're need to continue to evolve, need to continue to learn, and need to think about what is that next skill set. You mentioned ChatGPT and generative AI, understanding how to safely, eyes wide open, incorporate that is going to be a critical success characteristic for the future. I think that there are some situations, although I happen to think they're rare, in which command and control is the way to go about things. Relational leadership, being able to think, conduct yourself in that way, systems thinking, and making sense in ambiguity, is critical. You mentioned not certainty, but clarity. There are very few absolutes, but I feel relatively confident in saying we're never going to be 100% certain on almost anything, and especially in academic medicine now. But being able to bring clarity to what is the problem that we are addressing. We've talked about, yes, you need to focus, yes, you need to have your priorities, and also there are so many priorities that we are dealing with simultaneously in academic medicine. So clarity around what are we prioritizing and transparency around how we're making those decisions. We can't in fact address it all simultaneously. So what's the order? Who are we working with? How are we doing that? And so being able, again, to build those teams and enable them, empower them with the trust to proceed in those environments. I think for people who are don't quite see themselves as leaders, but want to be, don't wait to be invited to lead, and don't confuse busyness and a busy schedule with leadership. right? Be able to be the person who identifies a problem, who works to identify a solution and to change a system. And that, you can train as much as you want, but you also need to execute, and you need to have outcomes to back that up.
Well, excellent point of sort of competences, but also importance that current leaders as well as emerging leaders should develop these competences. And the competences today are not necessarily the ones for the future. But what would your advice be for emerging leaders, and how should they prepare differently? If the competences that enabled you to get to leadership position are going to be different to the future, how should emerging leaders develop themselves?
I mean, for emerging leaders, for any of us, really, there's a lot of self-reflection. Where are my limitations? And there is the ability to develop and engage in some of these programs for self, and also to make sure you build a team in a way that you are synergistic and working together. Nobody's going to be expert in everything, right? And so being able to identify that. When you think about, right, we were talking a little bit about this earlier, finance, operations, quality and safety, workforce dynamics. I want to acknowledge that in academic medicine, right, we often in these conversations are thinking about physician leaders, but there are so many more leaders in an academic medical department, and so we need to acknowledge that. But as a physician leader, I can say, right, what I learned in medical school literally has nothing to do with what I do on a day-to-day basis as a leader, right? And so being able to self-reflect and think about and ask for opportunities, whether they're formal development opportunities through didactic schoolwork certifications, or it's mentored opportunities, having mentors and sponsors, having coaches, right? And thinking about, there are a variety of ways to build those, and ask for them.
Excellent, very good. Tor, we've had an excellent set of competencies and some advice. What are the competencies that you say has been critical?
Yeah, it's hard to add much to what's been said. I guess what I would the point I would make is that first of all, maybe this is because I'm way at one end of the spectrum as a surgeon, but I'll bet most physicians are like this. We tend to be, we talked about this a little earlier, task-oriented people. It's important to recognize that relationship skills really matter. They're really tremendously important. It's not what we learned in medical school. Before you graduated from medical school, if you worked together on a test, it was cheating. As soon as you finish medical school, that's collaboration and teamwork and such. I mean, how does that all work? And these relationship skills are real skills that are a real discipline that can be developed and need to be developed. Coaching, my generation, the generation before me, you talk about getting a coach, they roll their eyes. What's the matter with you? It's tremendously valuable to have a coach. I've had 5 or 6 coaches over the course of my time, each learning something a little bit different from each one, and investing that time. It's one of those important but not urgent activities that is really worthwhile. So emerging leaders are going to be quick to want to learn this discipline or buy this book or learn finance and so on and so forth. I think actually slowing down and thinking about the relationship issues is critically important, because as you're building that team, you're going to need to be able to connect with those people that are on your team, and you're going to need to understand what's important to you and what's important to you and what's important to you, and take those interests and skills that those individuals have and then create a mosaic, rather than starting with, okay, this is the mosaic I've got in mind, and here's where you fit, and here's where you fit, and here's where you fit. That's not going to work. So those relationship skills, that's certainly where I've found the greatest challenges.
I could put a fine point on that, or an additional point on that. The course I just talked about, where folks said that they come for finance. They come in because they want the financial skills. But what really comes up during the class is the relational stuff. That's where the real issues are. So they come for that, and then they actually leave with community. the community, because it's not a safe place, it's not a safe place to be vulnerable as a physician, right? So this idea of finding a safe place in the class, but the thing that I strongly recommend for any new leaders that I am working with is this idea of finding your community, find your trusted cluster. We all need to have those people around that are going to tell us those things we really need to hear, or be a thought partner with us as well.
Yep.
Yeah, it seems one used to distinguish between sort of hard set of competences,
Right.
financial skills and project planning, so on and so forth, but also what used to be called soft competences. It seems that so-called soft ones are the most
hardest
important
ones.
and the hardest
Yeah,
ones.
exactly.
That's right.
That's very clear.
They're the hardest
our
and the
next
most
course,
important.
There was a really excellent question from online audience, and we've heard that crisis is the new norm. So when crisis becomes the operating norm, how do you lead differently? I'll start with Ted.
Yeah, I'm going to repeat some of what I said before. Like, I think that idea of first, it's that self-awareness, right? The emotional intelligence. Like, I sort of know myself, and I also have grounded practices. I have a place where I can go where I can be grounded and I can lead from there. I think that's it's a very slippery, soft answer, but to me, that's the kind of the core of it. And then from there, some of those other things we talked about. I think it's this idea of examining: can I act and behave more authentically? Because that's going to be a better match for what's needed at this point. But can I challenge myself to do that? And then some of the other things that we were talking about. It's the idea of can I as a leader look more precisely at what I'm rewarding, what I'm reinforcing, and can I reinforce these things we keep talking about that are more virtues in the situation. So I think really at the end of the day, it is so much of what we've been talking about. I'm sort of doubling down on what we've just said. What we've been talking about.
Excellent. Tiffany.
I'd say similarly, I had a former mentor who always used to talk about the tyranny of the urgent. Avoid the tyranny of the urgent, and I can still hear him in my head on a regular basis. And I, often will find myself, if my internal narrative is saying we don't have time for another meeting, that is exactly the moment I need to say, slow down, bring people together, have a conversation. Let's make sure we are focused on our priorities, that we are aligned, again, mission and values, that's where we are. So move from that reactive, right? When my narrative is saying we don't have time for another meeting, I'm like, you are in reactive mode. Let's slow ourselves down and let's get into proactive and planning mode. Another mentor always, reminds me actually in many meetings, right? Strategy is what we decide to do. It's also what we decide not to do, right? And so in those moments, taking the time to do that, to move closer to the work, to get out of the office, to go to the front line and make sure we are in fact hearing from the exact people who can tell us where the friction is and how to release that. And you just talked about this and I talked about it previously, but like looking at what does success look like? What are our metrics? And are our people at the center of that?
Excellent. So, these are not sort of very typical sort of leadership competences and responses one often hears. Actually, it's really great to hear these insights. Tor.
Yeah, I don't think crisis is the problem. I think chaos is the problem. And if you let crisis degenerate into chaos, then that's a problem. So so I think that as you were suggesting, Tiffany, staying anchored to your values, reassess where's the North Star, why are we here again? The needs of the patient come first. That's the Mayo Clinic coming out in me. Why are we here? Go back to your values. Go back to the basis, and fight the chaos. Crisis is not the problem. Chaos is.
Wonderful. Tiffany had said that that there's so many problems and so many priorities, and I think you all reinforced this thinking. As leaders, given all these challenges that you're facing and these pressures, they're not happening in isolation. They're happening together, and it's sort of cumulative exposure to these crises, and you're facing them simultaneously. So how do you determine what to prioritize and how to respond when everything feels urgent? This is a challenge. So I'm going to ask you a challenging question. Given the challenge faced by academic medical centers and the potential responses and approaches for leaders that you have so clearly articulated, if you could change one thing, just one thing in healthcare, what would it be? And you have 1 minute to answer that. So,
1 minute each, or are we
an
sharing?
easy question at the end. Just to sum it up. So I'll start with Tiffany.
Oh boy, okay. I think if we were to design the healthcare system from scratch, this is not the system we would design. I believe that strongly. I think, if we designed a system that consistently cared for the caregivers and the people doing the work, I think we would be in a much better place. I think I shared this in an earlier conversation. If we went back and read the personal statements of people applying to medical school and applying to residency, these are really ambitious, well-meaning, motivated, caring individuals with a lot of altruism, and we put them in a system currently that is associated with higher than the general population average of divorce, suicide, burnout, and lots of things. So if I could change one thing, I would take an approach to designing a system focused on the caregiver. If we did that, we would also see improved patient care, improved quality and safety, improved engagement. Like the downstream impacts would be great.
Excellent. Tor.
I think it's, for me, it would be refocusing on where the value is, and the value is created, and redefining value, and the value is in the patient-provider relationship. That's the foundation of it. We're so consumed with the dollars and cents for lots of reasons, but the value, which again gets to this, what are the personal statements? The personal statements are about how people were moved by the mission of healthcare. What we do is fabulous. There aren't many professions where you can just feel so good about what you do every day. It's so right. If we could refocus again on where the true value is created, then I would hope that we'd get one word we haven't used very much here is joy. Where is the joy? Where is the joy in medicine today? I think that if we refocused on value there, we might rediscover the joy.
Wonderful. Ted.
So we have joy, and we have purpose. I'm going to go a little bit more basic. I'm just going to say civility. I would love to see just civility. I think that might be more a product of what's happening in our society in general now. But the what, the chaos that you talked about, right? That turbulence that's coming our way, that's real, and we have limited agency in terms of changing that. What we have more agency over is the how. How do we handle it? How do we think about it? There's a really good TED talk that I listened to that kind of touched on all these. It was about joy, and it was certainly about finding my why. And it began with the person, a physician leader, being in a room during a party, and all the people in this party basically let her know that at one time or another she had made them all cry. And that was a watershed moment for her as a leader. That's not what we do, right? So this idea of there's this turbulence that we're facing right now, it's not going to go away. This is kind of the new abnormal, if you will, right? The turbulence. But we can make it a lot better if we treat each other well.
Wonderful. I mean, this has been an incredibly rich discussion. I've learned so much, and really wonderful insights. And summarizing is not going to be easy. And we started with sort of turbulent times. Then as panelists we have Ted, Tiffany, and Tor. It's not supposed to be an alliteration on a T. But I summarized sort of 10 T's. Believe it or not. Wow. So how do we manage in these turbulent times? So trust, team, transparency, not top-down, not transactional, tolerate ambiguity, take time out, as you said, avoid the tyranny of the urgent, and manage tensions, don't let crisis evolve into chaos, and finally find your true north. So those 10
Wow.
T's.
Nicely done.
That was
They were not written in advance, I can assure you. And the series of competences, I think very important message for for future leaders is ask. Find leaders, find mentors, find sponsors, find coaches. Prepare. Don't wait for people to reach out to you. And self-reflection and recognition of what you need to develop is very important. And you listed a series of competences. I'm not going to go into detail, but not just so-called hard competences, but series of what this calls soft, but what I see as critical competences for emerging leaders, but also for current leaders. So please join me once again in thanking our outstanding panel for a wonderful discussion. Thank you.